Hey, how are you today? Well, I'm here to tell you about the work that I do at the University of Minnesota. My name is John Wagner, and I'm the director of the Institute for Cell, Gene, and Immunotherapy. And more importantly, I'm a doctor who takes care of kids who have cancer, most often those that fail chemotherapy. As you can imagine, there's lots of work for us to do. The side effects from chemotherapy can be horrendous, limiting not only the survival, but also the quality of life for the patients we take care of. We can certainly do better. And here at the University of Minnesota, our work is focused on the development of targeted immune therapies. So what are immune cells? These are the cells that protect us from viruses and other infections, as well as cancer. We specifically focus on T cells and NK cells, but also B cells. All of these are part of our immune system. Each one has a particular function. But what we're doing is that we're modifying them so that they do the work that we want them to do. We're actually making these cells so that they target more cancers, not just leukemia and lymphoma, as has been already shown to work in recent studies. We're looking at ways of also reducing the side effects associated with these immune therapies. Sometimes they're too toxic because they're too effective at killing the leukemia. In other cases, they just don't last long enough because they're being made in such a way that the cells just don't survive in a length of time that makes them effective. So we're addressing all of these problems. We're also banking them in advance so that they're available whenever a patient needs them, rather than having to make an individualized product for every single patient. So I know what you're thinking. You're saying this all sounds good. When are you going to make this happen? And the answer is we can do this now. And with your help, we're going to be able to move this into first-in-human clinical trials, hopefully to get them into patients who otherwise have very little chance or very little hope of being able to live over the next year. So while this work continues to require funding, just know that already the work that CCRF has done has allowed us to develop some of the new ideas that you can make happen today with your additional support that you make happen. You are the reason that this incredibly important work can keep moving forward so fast. So tell me, what was your goal today? Was it 1 mile, 10 miles, 500 miles? Well, sure, 500 miles is a stretch, but aim high. So I want to tell you that we aim high every single day, because the idea of taking a child with cancer and curing them with a single dose of engineered immune cells compels us forward, and I hope it does you as well. So keep going, push yourself, because together, nothing is impossible. Thank you.